Hi, everyone. I am Danielle Varda. I am sorry for our delay today, just having a little catch up, but I'm so glad you're here joining us today. I am the CEO and founder at Visible Network Labs and also presenting today on our PARTNERme assessment tool, which is a social care platform that is focused on strengthening social support for folks. So welcome, and I'm going to go through a whole series of slides. We have a few things that you can interact with us on, but we're pretty informal, so at any time, feel free to leave a question in the chat, raise your hand, and I'd love to answer questions as we go along. So I'm going to go ahead and get started. And we always welcome building connectedness. So please say who you are in the chat, why you're here. That would be great. So let's get right into it. This webinar is part of a webinar series we've been doing all year on strengthening social connectedness, looking at different topics, populations, ways of doing that. And we're really excited to be showing one of our own tools today. This is me, I'm Danielle. I'm a few things about myself. I've been studying social connectedness and its connection to health, mental health, and wellness outcomes for about 20 years, first at the RAND Corporation. I've been a professor at the University of Colorado, Denver, at the School of Public Affairs for 15 years, and started Visible Network Labs about 4 years ago to take our technology and data and science and all that work and bring it into a place that we could really innovate and bring it out into communities. But before we start, one of my favorite things to do is kind of take a glance at who is here today. So this isn't a very fancy slide, and I'm going to switch over to the Menti in a minute. But if you all could go to menti.com, and I know I need to go there, so I'm going to switch over. I'll go ahead and put in the chat that code. Oh, it's already in there. So perfect. I'll go over there. What we like to do is make sure that we spend a minute just kind of sitting back and saying, you know, who's here? Who are the folks that show up for these kinds of things? And what do we have in common? So I'm going to go ahead and share the Menti screen. And if anyone is brave enough to go ahead and put your results in, that would be really awesome. I know I have some folks from my team here, so I'm going to prompt them to at least fill it up for me. But our question first is, let's see who's here today. So what are 3 words that describe you? And these could be your job. It could also be something about your family or an adjective or a hobby. Like you might say, I'm a teacher, but I'm also an uncle and I'm carefree and I'm a painter. So what we really try to encourage is we call it visible us, like who are the people behind these little Zoom boxes and what are the things that we're all interested in that bring us together aside from social connectedness as well. So go ahead and click on there, put your stuff in, and then we're going to ask one more question after this. So hopefully you'll be ready to do one more. So this is always really fun to kind of get to see what kinds of folks are here. We have a lot of researchers and friends. That's really sweet. And I love this because we get a lot of a mix of people who come from like a real inquisitive lens. I'm here as a researcher, I'm here as a psychologist, but then also those that are doing direct service and, helping people, especially around their social connectedness in all these different ways. Oh, I love that. Someone put loving and creative. Mom of a trans son. Crafter, writer. Thank you all for sharing so much. I'm going to let this go for just a second because it's bopping around. We share these at the end and we actually do them every time. So we love taking a look at the kinds of folks that showed up for the different topics and stuff like that. Okay, I'm going to switch to the next one. Thank you so much. This is really one of my favorite ones, I think. Okay, so the next one, how do I go to it? There we go. Okay, so just what do you think of when we use the term social care? So another thing we try to do is we know the language around this work is not the same for everyone, and we're not always able to say things in a way that makes sense to each other, and very, very much so to the people we're trying to serve, our patients, clients, things like that. Is this one working? I don't see anyone. I don't see it going. Do you all see it? There we go. Oh my gosh, it's like it just came alive. And so we're really curious about, the discourse, the language, the words that we use to describe some of the things we're all working really hard to try to provide and, wrap around people that we love and that we're trying to help. So thank you. This is so great. Empathy, relational, proactive, helping others, whole person. Great. I'm going to guess today that we have a very, what is the right word I'd want to lose, but just a crowd today that is just really willing to think about the really like emotional side of social care and what it means to really help people get to that better place of wellness and mental health and health. Empathy. Great. Okay. Well, thank you all so much. We keep those and we share them back out, and we use them to just really try to think about our own work and what we're doing. So, okay. Well, that was a moment we always try to take, because it's so easy to get into a webinar and just be, kind of all over the place where we're not really acknowledging who's in the room. So we like to take a minute to do that as well. Hang on one second. Oh, there we go. Okay, my Zoom wouldn't work quite well. Okay, so let me get started. So we are Visible Network Labs. We are an organization, a social enterprise that is focused on making invisible networks visible. That is our core work. We believe that if we can make these complex social relationships around us visible, we can do better work. We can leverage that information and that understanding to help people and to build stronger communities and to make sure people have the things that they need. We do that work through this lens of vision, where we believe and we hope that everyone has the social support they need to thrive. And we do that through technology-based data and mapping tools, learnings as trainings and workshops, and we hope that's all bringing opportunities for collaborative innovation. So our primary work is on building out our partner platform to do this work. And today I'm going to talk about PARTNERme, which is one of the tools on the partner platform. So partner stands for the program to analyze, record, and track networks to enhance relationships. It is a long acronym, but that is exactly what Partner does. And as you can see here, we're really well known for network mapping, systems mapping, and that kind of work, where people use it to kind of track their ecosystems and connectivity over time. And we're going to kind of bring these worlds together in a minute. But what we do on Partners, we have two tools, the PARTNERme tool, and then Partner CPRM. And I'm going to be talking about PARTNERme throughout this webinar. The Partner CPRM stands for the Community Partner Relationship Management System. And that is really a little bit meant to sound like a CRM, because people use it to complement their own CRMs to understand not just the people in their ecosystems and organizations, but how they connect to one another. PARTNERme, I'm going to explain in more detail, so I'll show you that in a second. This is just one of our slides where we say thank you, to all of our partners. These are the kinds of folks that we work with and primarily that we learn from. They're the ones that help us grow, because they give us access to people and communities that allow us to learn and develop great measures and ways to translate complicated data and measurements into practice and helping people. Okay, so I'm going to talk about PARTNERme, and I'm going to do it in a few ways. First, I'm just going to kind of try to set the stage for why understanding social connectedness is not only essential and critical, but probably something we can all relate to. And I do that through a little bit of a story. And then just a little bit of our research background, why we developed this and in the way that we did. And then we'll demo it for you. I'll give you a QR code in a moment here where you can try it if you want. And then we want to end today with showing you what we've learned. We've been implementing this pretty solidly for about a year. We've learned a lot of things from the people that we've worked with. So that's what we're going to do here. But I often start with a story that really has motivated me to do this work, and I think also is kind of relatable for why social connectedness matters so much. This is a picture of my mom and my middle daughter, who is now 10 years old, just about to turn 11. And this was when my mom was in the hospital shortly before she passed, but towards the end of her diagnosis with breast cancer. And I used to go to all of her appointments with her. And I remember going to this one that was really significant for me because we were at the appointment. And I remember that her oncologist said to her, through all of his normal questioning, how are you doing? What's going on? How are you feeling? And he said, are you struggling with anything? And she said, I'm starting to have trouble getting up the stairs, getting around, making meals for myself. What I know now are some of a person's social determinants of their health, right? Like not being able to eat well, not being able to get to your appointments. And he said to her very expectedly, do you have anyone to help you? And she answered, yes, I have 3 adult daughters in town. And he was just thrilled and moved on. And what he didn't know is that 2 of us are estranged and another one's husband had just had this stroke. And there was really no one actually tracking these needs for my mom very well. And we certainly weren't coordinating care together. And that is the kind of thing that had he maybe been able to say to her, well, do you trust these people to help you? How much are you depending on them? Do they work together to care for you? He might have had some greater insight into what I know now is that she was suffering from what we refer to as adverse social connectedness. So appearing to be connected to a lot of other people, but maybe not in a way that actually is helping you towards positive outcomes. And this was really meaningful for me because I'll show you what I was working on at the time right now in a moment. And I'd been doing this work forever, and I'm her daughter. And I'm thinking, how did I not know this? So if I can't know that, how are other people supposed to know this about people? And when someone that they're working with is at risk of adverse social connectedness or not. And we know social connectedness matters to outcomes. This is just one statistic about women with breast cancer. And of course, you can find hundreds, thousands of other studies that argue and show that social connectedness matters to outcomes. But what makes this also very, very challenging is that all of us, although we came today and we all sit around existing in our own social support networks, they're totally invisible. They look really different for different people. And they're invisible not only to ourselves, but to the people who are trying to help us. So this makes it a very important factor to our health and mental health wellness outcomes, but almost one of the most impossible ones to understand about a person. And that's actually why we do this work here at Visible Network Labs. We're trying to help answer that. Okay, so part 2 here is just a tiny bit about some research that we did that got us to the point of creating PARTNERme. It's all based in research. It's all based in learnings that we had from doing years and years of work on trying to understand systems and how they're connected to outcomes. So this was a project I did with Dr. Ayala Talmi at Children's Hospital, Colorado, on the system of care for babies and young children with special health care and developmental needs. So our legacy work at Visible Network Labs is to try to understand large systems like this and how systems of care, for example, like the picture here, and in this case, babies and young children with special health care and developmental needs, works together to help coordinate those systems and make them better for people. This is a picture someone drew that we got off the internet that basically shows what the problem is. Like you have a child and that's complicated enough, then you have a child with special health care or developmental needs, and it becomes increasingly complicated. So how do we help families navigate these systems and connect them to the resources and people they need? So what Ayala and I did is we went out to do our systems mapping work, our high-level work on ecosystems to say, in Colorado, what does that look like and how can we use the data to improve the system? So we did a survey using Partner and we asked people who they work with and who is part of the care coordination and system of care for these young children and their families. And this is what we saw. And I'm not going to do all the results of this study, but you can see here, the inside is primarily more of the urban Denver areas. The outside ended up being more of our rural areas. But we got a systems map and we were able to look at it in a few different ways, like where are the mental health members of that system and are they connected and are they coordinated and things like that. That was a really helpful way to look at the data. We took it out to communities and people said, can I just see my county? And we were able to kind of look at where there was strong connectedness and not such great connectedness. And then we started doing these exercises with people, and we would say, well, what would the ideal system look like for you? And we'd actually have them put pins in the board and thumbtacks and rubber bands and build these out for us. And what was really catalyzing, just really pivotal for us, was when we went to families and we said, families, look at our fancy data. And they were like, hey, where are we? Where's the family node? And we actually hadn't put a family node into these networks. So we didn't put them in. Our respondents didn't actually put families into this either. So we just stopped and said, and the family said, I'll do this network mapping stuff, but really the system to me looks like this big ball of rubber bands. And all I really care about is that when I need help for me and my family, that what I can do is navigate the right door. And we had this one mom, she took the big ball of rubber bands and put it at the top of the board. And then at the bottom said, these are the people I count on for my system of care. And it was like her friends and family and her church and her neighbors and her primary care. And I remember she put her insurance in there. And she said, those are the people I need. And when I need extra help, I just want an easy way to get there. So Ayala and I said immediately, wow, we might not even be measuring the right thing for what is a good system of care. So we had people start drawing pictures. And this is a picture of a mom with twins with special healthcare needs. And you'll see in the box, people draw, when you ask them what their social support looks like, their networks, they surround themselves with informal supports, friends, families, and neighbors. And then on the periphery, they always put their system supports. And that is a pattern over every family, no matter zip code, condition. We always saw them put their strong ties there as informal supports. And yet, when we went back to our first study and this one, we thought, my word, this is so different. Families have a completely different view of what is support for them than the system does. And we're going to show you some new data on this also in a moment. So we realized that if we continue to try to build these perfect networks, from a systems perspective, we won't really understand how to make it more successful for people trying to navigate them. So what we learned is that families have a preference for tapping into their informal supports first, and then they want to use a system, but first informal, and they really want to help themselves. They're not that open to saying, I want to be in a system, I want those dependencies. So we took all of that and we said, why are we continuing to try to build these systems that people are expected to fit into, and why don't instead we make systems that fit around people? So we started to ask, if the system is coordinated, then it should be reflected in the personal networks of families. And maybe a high functioning system is actually when 100% of the people in it say it's working for them. So we said, what do we do with that information? The first thing is we have to understand personal support networks. And then we have to build adaptive systems to respond to those variations. So all that work, I kind of went through that kind of quick, so I want to get to the thing, led us to building PARTNERme. So PARTNERme is our response to everything I just said. Why, how are we going to understand the role that social support plays in the success of people navigating systems? Is there a way we can bring a strengths-based approach to the work? Can we uncover those gaps and strengths in a person's network in a way that would allow our providers to see something they maybe didn't see before, allow, my mom's doctor to see something that he didn't see before, so that he wouldn't just move on, but rather, how do we attend to those gaps and adversity of social connectedness? So, whoops. There we go. So PARTNERme is the response to that. Luckily, after I'd been presenting this so many times, we got invited to the Innovator Society with the Community First Foundation, and they let us participate in a competition, and we won $65,000, and it allowed us to build our first version of PARTNERme. We later went on to win the Prime Health Innovation Challenge. So these are the ways we've really supported this, to really, in the last year, implement it and keep studying these things, questioning these things that we're trying to learn about. So I'm going to show you some of this. We launched our first pilot of this in March of 2020 in an integrated pediatric care clinic. So we just took the hardest situation we possibly could and got going. We quickly had to learn that this needed to be a tool that didn't need to be administered just in an office. and in person. And so we have a link that I'm going to let you click on in just a second that that someone can click into and take the assessment. And so it's a great telemedicine tool. It's a great remote monitoring tool, and just a way that we have found people are able to understand this, whether in a clinical visit, or whether it's before someone comes or as a follow-up after. And we also spent quite a bit of time becoming HIPAA compliant, which allowed us to collect more PHI and be able to increase some trust around that. So this is a QR code. If you click on it, it'll take you to the PARTNERme assessment. It's just a little demo assessment. I'm going to walk through it, and you can do this later whenever you like. But the one that you're going to see includes some questions around social connectedness, also the PHQ-9 and the GAD-7. So some more typical screeners that people use. And that's to show you that any questions can go into PARTNERme. It is a very, very flexible tool. What we offer that's unique is the social connectedness part and some other things that you'll see. But we know that a lot of people have things they already ask of people. So this is a way for them to put it all in one place. A lot of people are using paper surveys. This is an easy way to get it all into one database. Integration is a whole nother thing we can talk about towards the end. Okay, so I'm going to move on. Hopefully you captured that if you wanted to. So this is going to be an example of what PARTNERme is. It's a screener, it's an assessment tool. And this is just a demo of a slideshow, and I'll get to it later. But for example, people might be asked questions like to rate their own health, to answer whether they feel lonely or isolated. Then we usually get to a question that says something like, who do you rely on when you have problems? And people will tell us, this is the same question that my mom was asked, do you have anyone to help you when you need it? And you list, people list those folks. But then we take all that research, all that learning that we had, and we go a step forward. We will say, and so when people list who helps them, the little network map pops up like this. You'll see it if you're doing it. And just for this demo, because you're probably on your phone, we would suggest you not put too many others in, and you'll see why that's not actually a crazy ask. It'll make the screen work a little bit better for the demo. But what we do is then we ask people the next question, for example, which of these people could work together to coordinate care for you if you needed it? And what we might do for a child or a young person, we might say, do any of these people know each other? So the question might vary depending on the audience, the population. But what this does is really immediately it gives us a perception of whether that person has, whether they have a perception of a coordinated network of care or not. And so we know, we've all talked about how important coordinated care is, but we have no idea if people believe they are in that or not. So this is just one of the very first quick data points that you get to see if that person believes that. And there's a ton of variance in this. So sometimes people have lots of different connections, and other times they don't. And it's almost impossible to look at a person and know. I can't know of any of you on this webinar, if you had a crisis today, would you have people to go home to call and work with, and could they coordinate for you? So this gives us some insight we wouldn't get from a very simple approach. Then we'll also ask them, to what degree do you trust this person to help you when you need it? And to what degree do you depend on them? And I'm going to show you in a minute where we use that. And then people are often asked what their most pressing concerns are. So when I asked earlier, what is social care for you? Social care for us is defined in three primary ways. It's the social connectedness a person has or brings to their care, their social determinants of health, their social and economic needs, and then their mental and behavioral health needs. So we try to incorporate those three types of assessment into this work. Some people add others or take some of those out. But so we look at social connectedness, but we also have these social determinant of health questions. And some people bring in the prepare screener, they bring in their own things, but this is just a very generic list. And, if you're working with adolescent youth, it's going to be different than veterans. And we'll talk about that in a minute. So let's say a person says, I need childcare, food, transportation, and work. So in a normal process and an everyday, not every day, because it's not still very common to screen on social care, but if we do, What happens next is a person says, I need these 4 things, and they get referred to 4 resources. So what we do is we try to take a little bit of a different approach, and we draw a new map from them. We take the answers to what they need and then who helps them. And then we say, with your finger or mouse again, who helps you with these concerns? And they'll draw connections. And what this allows us to do is find their most pressing concern with the least amount of social support. And the reason this is so important is because of all the research that we just talked about. It is strengths-based. So I could say, hey, Mark, it's really great that you have some help with childcare and food. You're doing a great job. So we're honoring the assets people bring to their care. We're letting them know we want them to take care of themselves. But then we can say, but it doesn't look like anyone's helping you with work. So we can find this place where we can connect them to systems resources. And what we think and what we're testing through our hypotheses is that if we can approach people this way, strengths-based, with a focused, very personalized look at their needs, we will increase follow through, because we know people don't follow through. They're overwhelmed with 4 resources and they don't know where to start. But if we can focus on one, we might be able to get them there more successfully. And another hypothesis that we are focused on is that we believe this increases trust between the provider and the patient. When we approach people with a strengths-based approach, assets-based approach, we believe that they will respond better to this, because people told us they don't want to be told you need a system, but they do want to be reinforced that we believe they're trying to help themselves. So it's very subtle. It's not even rocket science. It's just this very specific way that we bring a philosophy into the work. All right, so what we do with that is, for providers and also patients or clients can see this, we create what we call a social care plan. I'm going to show you this in real time in just a minute, but a social care plan is where it all gets summarized. So as soon as a person is done, they hit done and these appear. We can have a different one appear for the patient than for the provider. So sometimes providers want to see things that we don't want the patient necessarily to see, but we built this to be patient facing. So we built it so that patients have immediate access to their information, and we think they should get everything, but providers have different, we've learned this, very different preferences for what or when the patient sees the stuff. So you'll see maps like this. We mentioned that we measure on trust and dependency. So what you'll see, actually, if there's a low trust relationship that someone is highly dependent on, it'll be a blue dotted line. And so that tells us right away that even though they have these connections, they may not be very strong connections. We look and score things like their trust levels with each other and their networks, dependency, loneliness. We have screeners that we use for that. And then their social connectedness level is something that we have worked on specifically here at Visible Network Labs, because what we're looking for, so adverse social connectedness is often defined as someone who is lonely or isolated, but also there's those other folks like my mother who might have a lot of connections to people that they're highly dependent on, but maybe don't trust to help them when they need it. So what we're trying to do is really get at the complexities of these social connections and look at them and measure them in ways that get us further than just saying this person looks isolated, we need to work and help them. We want to be able to help and identify people at risk of all kinds of adverse social connectedness, because we know we can give them all the social support, all the resources we can find for them, but if they don't have connectedness, in a way, it's almost a mediating factor. It's whether they're successful or not. So we're looking at that, and you can look at it over time. We are connected to resource databases, but we are agnostic to the resource database. And what I mean by that is you can bring the resource database that you love into this program. We are an assessment tool, and we primarily connect to people's binders, their spreadsheets, their CSV files. People can upload their resources into the tool, and then we can help, we will tag the resources to match the needs question. Some people like to connect to online database systems, and usually the answer of whether we can integrate with that depends on the online resource, if they give us permission to use our APIs or use our connections, integrations to go into them. So our goal is not to rebuild resource databases, but to put them in here in a way that helps folks. And something I don't have showing here, I can show you in a second, is the provider actually can go in and there's a little box that says suggested for you, and they can actually go in and just pick through that longer list of resources, the ones they want that person to focus on. So I'll show you that in a second when I show you the social care plan. So kind of rounding it all out together, what we do with this is we take these, what we know about each of these individuals, and we drop it back into these larger systems maps so that we can see who needs what, where people are getting referred, what that larger system looks like. So for a clinic or a program, when you're trying to understand your entire population, that allows you to keep track of and map all of that. Also, we provide data and analytics that allow you to look at like different parts of the population, 14 to 24-year-old females. And if you choose to, you can integrate their medical record information into it and things like that. So you can really start to put all of these data points together about their social care and see it right inside there. So just a couple last things, who uses this? So obviously we'd love to scale this at the greatest, in the greatest way possible. My dream is that everyone have a social connectedness assessment in their medical record, but we have a long way to go before we can get there. And so we have folks using it in home visiting situations, schools. Our first users were firefighters using it to visit high utilizers. And this is actually my daughter, different daughter, who's now 13, who really opened the door to me seeing the use case for this for kids. So we've been working with the Annie Casey Foundation for a few years on running a social connectedness fellowship for adolescent youth with the youth on our team, who have helped us really understand why this might be an important tool for young people. Of course, we change it for young people. Instead of saying, what do you need? Work, transportation. It'll say things like, what do you need help with? Or what are you struggling with? And it might say like being hungry, being bullied, doing work, getting sleep. But this has been a really fascinating way to see young people interact with a technology to talk about really, really hard things. And what we do know is that we have a lot of people who are unwilling to say things out loud, who are more willing to put it into these tools. Adults and young people, we're all addicted to the technology. So I truly believe in using technology for good. And I do think this is giving new voice, especially for kids, on how to talk about their hard things, show their social support systems. The first time my daughter did it was because she was just I asked her to break it, and watching her go through those questions, even rating her own health or talking about what she's struggling with and drawing pictures of her social support network. And again, here I'm her mother, network scientist, and I'm like, how do I not see these things about her? So these tools, we believe, is one way to really make progress in an area that seems out of reach, complicated. So what I'm going to do here is actually show you the tool, and then I'll end today with just some, let me see if I can get there correctly. Hold on, I think I'm not sharing my whole screen. So let me do that. Okay, so this is the actual platform, and I just want to show you, I'm not going to show you how everything works. Some of you might be using the assessment tool that we have, and others may not, but this is what the backside of it looks like. So if you were using this, demoing it or anything, this is what you would see. I have just a ton of projects here that you wouldn't have because I've been doing this for so long. And hold on one second. I just realized that I don't have my demo up. Hang on. This is way more than anyone would ever have. So don't worry that this looks overwhelming. Oh, here it is. Okay. So this is what the backside kind of looks like. So when you're in a project, there's lots of things you can do, and I'm not going to go through all those steps of it right now, but you can at some point, just see your patient list, and these can be de-identified. They can be identified depending on what you need. There's lots of different ways to administer this. Most of it goes out through a link, but I might look at this patient, and I want to see what their social care plan looks like. So I can come in here and I can see that. It'll pull it up, and what we'll see are the results. So the first thing you'll notice is an orange bar at the top. An orange bar is something we learned, I'm going to talk about it in a second after implementation. If you're going to ask people very personal, hard questions, there needs to be some way to identify when they're really critical. So for example, this question, are there any, you'll see it up here, are there any mental health concerns, thoughts of suicide, self-harm, aggression, running away that need to be dealt with immediately? When the person answers yes to this, it triggers a notification system. It lets the orange bar come up here, a pop-up will appear for them with immediate resources, and an email will go to you that says someone just screened on a critical need. So we learned from implementation this was a must-have. And so that's all set up. You set up what you think is a critical need. So that's one thing that popped up here. Under that, you'll see just some questions to the answers to the questions that they might have answered. And then some of these scores around things like depression or anxiety, emotional, social loneliness, things that you might have chosen to measure. And you can see these change over time for them, kind of watch that. You'll also see their maps down here. And I mentioned if it's a dotted blue line, it means it's high, low trust and high dependency. So in a view, you can see, what people said. It's a great conversation tool, really helpful. Down here are the resources, and here's the suggested for you box. So this is in their social care plan. I can come in and I can say, what I really want you and your family to focus on is getting to this dental clinic. And I can pick that, and that will be at the top for them. You can do the same in each category, but to limit what they see, so it's not so overwhelming for them. So that's here. Within the social care plan also, you could go and to different parts of it and see like more details about the scores and ways that they rated other people and things like that. You can also look at resources more specifically. You can save these as PDFs and send it to them. Then you can also go in and create goals with them. You can come in and talk and insert, type in through narrative, different things they want to work on. You can have prompts for motivational interviewing and things like that. So that's kind of how that works. And then one of the really neat parts about this also is that I talked about that kind of aggregated data analysis that you would see. So it's coming, but what's really nice in the tool is that you can look at that aggregated view. So this is an unusually long delay, which always is a risk when you do this live. So what I might do, let me try something else really quick. I might try to look at it from just a different view, and I'll let you all see it with me. So this might be my internet. The whole thing is slowing down. So maybe I'll come back to this in a minute. What my goal is to show you the actual larger system of PARTNERme and the larger aggregated numbers. And so what I wanted to show you, and hopefully I'll get back to it, is the times when you can look at how many people they said live in their household, how many of them are rating that they feel they have, good health or not, how many are lonely. So just kind of what I call the regular kind of data on this kind of stuff. So, okay, I'll come back to it in a minute. I'm not sure. Oh, wait, here we go. This might be me. So what I'm going to do here is see if I can look at it from this perspective. Because one thing I like about this is that, okay, I'm going to let it pause and I'm going to come back and I'm going to just share the last part of our webinar, which is our findings. So I'll come back to that in a minute. And let me make sure this is it. And what I really want to get to down here is what we've learned after doing this for a year. And then I'm just going to open it up for questions. Okay. So our team brainstormed about this, and what we're doing is we're working on writing, we're working on publishing this stuff. We continue to go out into organizations and communities and try to test this out. We're not quite as far as like scaling this at market, but we are still learning in a way that we want to make sure that it's in at least really solid shape. So if you're interested in being a part of that, let us know. But here's some of the learnings that we've had so far. So implementation for us, we're going to do some implementation learnings and then some actual research learnings. But one thing that we learned very early on is that in the workflow for folks, which is very, very complicated. Some people have 5 minutes. Some are sitting with someone for an hour, but there's lots of different screeners that people are trying to decide what to give and when to different people. So this has a lot, this is where we learned pretty early on, hey, if we can bring in the PHQ-9, if we can bring in the things that they want, and some of the, published and valid screeners in here, this will help their workflow. They won't have to choose, or if they can come to a patient and just put in the one they want to use that day, it can be very, supportive for that person so that they don't have to have a paper survey here and all these different ones. So, and one way that we feel this has been really helpful is that there's some providers who are very specialized, like primary care or, some kind of specialization, and it's not in their wheelhouse usually to think about food insecurity and housing. And so this is a way to also support and encourage people to do social care screening without having to become an expert also in those other things. We've learned, and this is very common across this conversation, that trust in resources is key. So if the resources are all terrible, people aren't going to follow through. But what we've learned is that there's a lot of innovation around community hubs, bringing resources all into one place. Most of our users use a spreadsheet because they want to have a list of known referrals. So we see less users who connect to like a big resource database and rather have a curated list and that they update every now and then. I talked about notifications and why those are absolutely necessary. And we've learned from our users, the person-centered aspect of this, the patient-facing part of this is totally unique. And we didn't know that. We just built it for that reason. And what we've learned is that it kind of goes to that last bullet, or actually it's on the next slide. But that this is giving people a way to tell us what they need. We don't have to define it for them, and we're not diagnosing them in ways that they aren't creating collaboratively with us. That social care plan I showed you, we've made a ton of progress on it. It is now interactive, it's goal-oriented, it's very specific for being able to help that provider-patient relationship work over time. And then, of course, the need for specific population focus. So we work with veterans, young people, we have adults in primary care, we have people with families. So of course, the survey we use, Forward Flag is one of our VA veteran service organization pilots. And of course, and one of our team members, Jaleese, who's on the call, I think, has paid very special attention to the language and helping people understand the words that we're using, attention to health literacy, approachable tools and things like that. So we just know must be tailored. Okay, one last thing on that, on this section, is really what we've been learning through the research, like how do these data help advance the field and help us know more about how to create better health outcomes. So one thing that we've been looking at, does this really impact trust with providers and follow through? I'm going to talk about that next, but we do a lot of analysis of these data. We are working on that social connectedness, risk of adverse social connectedness level, because we don't want to put it out in the world if it's not true and it's not tested and it's not valid. So we've been doing a lot of research on that to test it against our other assumptions. And so this is one of the things we hope to publish on. So just a little note, kind of nod to that really is what this is. But some interesting findings we've had. Actually, I think I put one somewhere else and I want to get back to really quick. Oh no, I think I might have actually taken it out. I'll find it in a second. But some interesting findings that we pulled out as a group. Over the course of the last year, we have seen that the concern that people pick for as mental health is rising across all the populations. And it's also rising as people's most primary concern. So this is not necessarily a mental health tool, but we ask about mental and behavioral health, and we're seeing as a trend across all populations and use cases that this is rising. Most people actually have small networks. Most people list less than 3, which is interesting because we talk a lot about, well, how does social media affect that? You know, what has COVID done for that? Lots of inquiry we have around there. And it means, people tell us it means a lot to describe who they are, their needs, and their ability to express themselves. I'll show you this. I'm going to show you some of these results in a minute. And youth especially, they like to use their own words, and they are just really, this is opening a door to this kind of work that we haven't really been able to do before. So some of those results look like this. This is from some of our primary care clinics. When we ask people, you know, to list their connections, most only have 1 to 3. The next biggest group there is 4 to 6. So this might be surprising, but there's a kind of seminal paper called Social Isolation in America that was written years ago using general social survey data. And there they found that most people say 6 or less when answering the question, who do you discuss important matters with? So we want to dig in more to this to see, this is true across a lot of our populations. Our veterans are the same. This is some work from our, let me get out of this for a second. Hold on. This is some of the findings from our veterans. And so what you'll see here, whoops, sorry, is that this lists what people have said is their most important need. So money and mental health is always kind of high. A shift we made about midway through the years is we now talk about financial assistance and not just money. So we've broken this out. We learned that this is too general and not clear enough. And then this is interesting because what we see here is that while people, the gap here between what people say they need and the other one is the other bar shows to what degree that need is being met. So we can see that where some of these areas are where people have high needs and they're also not being met. So that's been an interesting finding for us. Couple more. The working with young people has been just fascinating. This is, we have a report. We have reports on all of this we could share with you, most of them. But this was some expression by young people. Instead of asking them to pick their race, we asked them to freely type in like how they identify. And this was at their prompting. And they were so responsive to this. They very, very much loved being able to identify in the way that they think of themselves. And so that was just a neat kind of research finding. We also find in our young people that anxiety and depression is greater in our younger population in many of our studies. And just 2 more, this one is really something that we learned early on. I talked about, this is a study that we did in Southern Colorado looking at early childhood centers and screening on ACEs, adverse childhood experiences. And what you'll see here, these are the needs in blue that people have said they need. The yellow nodes are the ones that the people providing services thought that families needed. The purple are the organizations and resources that people said they needed. So we saw this huge kind of increase in variety and diversity of resources that people told us they need versus our own perception of what we think people need. And finally, and some post-assessment findings. So we ask people afterwards whether the tool worked for them. So this is a case of a follow-up survey. So for example, we asked, what's the current status of the need you identified at your last visit? Some said their needs were resolved or they were actively working on them. Down here, did you have any problems accessing these resources? Most people said no. How long did it take you to get help or resources you needed after your visit? So while some people said 1 to 2 days, everyone else said over a month. So this is definitely an area of work for trying to help. How do we get people to resources sooner? We also asked, did you have any of the following problems accessing these resources? Most people said no, with some yes. And to what extent do you agree with the following statement? I thought these resources were useful. So some pretty positive responses in this particular population. They were part of a program of support where they would come back at different time points for help. So that could be a little bit of why they are positive about this. Are you getting the support you need from the people and resources around you? At time 1, there was much more variance. At time 2, more people said yes. So there's a huge difference in people reporting success at accessing these resources over time. And we love having these data and finding these things. And so we hope to do just a little bit more of that. So I'll stop and let me just open it up. If you have any questions, I'd love to hear them, talk about them now or even field them later. Here's my email if anyone would like to contact me later. So let me just open the floor for a minute.
Hi, Danielle.
Hi.
Can I ask a question?
Yeah, please. Let me stop sharing.
Okay.
So yeah, please.
Sorry, I jumped in a little bit late, but could you give us a sense of, and sorry if I missed it if you already shared, but how this is typically used, like the organization type, if there are examples of where there are multiple agencies with licensing to be able to use the platform for the same clients, kind of how that works in various scenarios for different agencies.
Yeah, and we're, the way that I even talked about this, we did all this research, built this thing, and then we've spent about a year in implementation. And most of that implementation is funded by grants or contracts or projects. So most of our relationships so far have been very personal with an organization where we come in, it's almost like reciprocal benefit. We get to try this out and they're using it as well, and learning more about patients, but also hopefully creating better systems. So we've had a little trial and error. I mentioned that we started in an integrated pediatric care clinic. I kind of laughed because it was March 2020, and we learned quickly, like, this is not the place to start. This was so hard because we've got parents with kids in arms, and we were handing them an iPad when everyone's like, don't touch anything, So that was hard. So over time, what we've learned, some of our more ideal use cases, our mental behavioral health centers are real ideal. During COVID, it's given people a way to have a touch point, like over Zoom. You could do this together. Keep up with people who are on long waiting lists, but the primary factor there is that people had time to do the screening. In a clinical setting, like in our primary care clinics, often what they might do is send it to them ahead of time, and then they will have the reports to discuss during then. But I will say, I think the most successful primary care or clinical settings are integrated, where we're integrating behavioral health or social services with that primary care. So those are kind of our types of users. Anyone who has a little extra time is better. Integrations is another thing. So we have folks who everyone has their own EHR, and so different systems. We know nobody wants to open a new system. So that's been a challenge for us. And we actually are still deciding now, like, which EHRs to integrate with, because we've wanted to make sure it was kind of like worth the investment. But right now we call it the human API into the EHR. People can download the PDF and put it into the EHR, the medical record. Also, providers can share the login with the correct permissions for a patient so that they can all log into their PARTNERme assessment if they need it. So we've gotten through some of those things. Integration into the resource databases has been fun. We always prefer when people bring their own resources in because it's just easy, it's clean, and we do that. We're working on some integrations with some of the larger ones. Some are more open to that than not. So I don't really want to throw anyone under the bus, but there's some that are very, very amenable to us integrating with them, and others are kind of a closed system. So that's another area that we're working on kind of in terms of advancing it. And the very last thing I'll say is just we welcome right now people who want to work with us on using it. We don't really sell it like at a large scale. We're kind of trying to take a slow, even though the world around this is moving so fast, we just want to get it right. So our goal is to continue to experiment, research, get into use cases that get us further along. And our goal ultimately will be to get this into a market, in a way that can scale. I'll say it one more time, like my dream is getting this assessment into everyone's medical record. So that's the end goal for us. But we can't rush it. So I don't know if that answers your question, but we're real transparent about kind of like how we're not really, trying to push it too fast, too soon.
No, and I think, thank you for that. It does, because I think it's clear, at least for us, and I appreciate on behalf of we've got some team members on the call here too.
Nice.
The patience that you all have had and the conversations we've had along the way to kind of help us understand better how this fits in with how we do things, and how, as we're developing new program areas or new activities, how do those forms and measures that we currently are using could dovetail into this. So we definitely appreciate that.
Nice.
And thanks for offering this too.
Yeah. Well, you all are very innovative. Will you introduce yourself real quick, just in case anyone is wondering who you are?
Sorry. Hi. So I'm Mickey Carpenter. I'm with the City of Azusa and the Community Resources Department, but we also have a local collaborative, cross-sector collaborative that we call All In for Azusa, which is also a prototype of a larger initiative that's regional, called Healthy San Gabriel Valley, which is in LA County, which is a huge animal. And we're trying to figure out, how do we do services and connect all the dots between not only the services that our residents need, but also how do we connect into those LA County resources that we know people need access to. So we're exploring, and we've been very fortunate to come across BNL and all of the expertise you have. So thank you again.
Yeah, well, we're like, when communities are really innovative, they're a good match for us. People who are just like, we want to tackle this hard thing too, and we're willing to like try something different. So thank you. Is there one last question maybe before it's time? This is like teaching. I'm a professor, so if you're like teaching these days online, no one has their screen on, and it's like young people, they don't care. They're not going to turn it on. So I greatly appreciate everyone being here, my team, and I love talking about this stuff. So please keep in touch. Hi, Alexandra. It's good to see you. So we would welcome the connection as we go forward. We're clearly interested in building this out. So thanks for thinking of us, and hopefully joining us in the future. Thanks, everyone.